Let's take you to the northwest now, where residents, civil society groups and representatives from the SAPS will gather in Mahikeng today to discuss ways to tackle substance abuse. The dialogue has been organized by the province's Social Development Department in partnership with the Central Drug Authority. Newzroom Afrika's Refiloe Seboko joins us now. Refiloe, an important issue that continues to affect communities across South Africa, across the world even. Talk to us about what's set to happen today.
Well, an important discussion indeed, together with our viewers. That's why we see today that the Central Drug Authority, together with the Provincial Department of Social Development, have come together for this dialogue that includes different stakeholders. Civil organizations are also here to discuss the drug abuse challenge, which is a huge challenge, not just for the Northwest Province, but like you said, in the country as a whole. This is also in preparation for the third national summit of the Central Drug Authority, which will be held later this year. But I'm joined by a spokesperson of the Central Drug Authority. Thank you so much and welcome to Newzroom Afrika. Let's talk about this dialogue, the essence and what it entails when we're talking drug and substance abuse.
Thank you so much, Refiloe. I think for us, the first thing as CDA is basically to engage with communities. Our responsibility as the Central Drug Authority is to see and to realize the implementation of the NDMP 2019 to 2024, which obviously means that we need to interact and engage with communities. That also forms part of our reporting to Parliament as well as the President. So today's engagement, basically, it is our fifth province that we are visiting, is to get the challenges from the community, and these challenges will also find expression at the national summit that we will be having in November later this year.
And from what you are observing and you are noticing so far in terms of the huge drug and substance abuse challenge that we are having as a country, what is of concern to you as a Central Drug Authority?
I think at this point, when one speaks to there are various challenges across all departments. Challenges within education. You see the many school dropouts. Children dropping out as a result of substance abuse. We also see the many challenges with regards to access into treatment. People just aren't knowledgeable. They just don't have the tools on where to go, what to do when they find themselves in the predicament. We look at the country as a whole. We are aware that there are so many illegal foreigners in our country. We look at the lack of border control in our country. So those are all the issues that we actually need to address. The economy also, the unemployment amongst youth. We are always saying that the youth is the future of this country, but if you look at the state of the youth, it's a rather sad day for South Africa.
And when we talk, some would say, when we talk more about drug and substance abuse, of course, issues of drugs like your nyaupe, alcohol, it's what is really of concern. But I was listening to the Deputy Minister of Social Development the other day who says that we are all drug addicts in waiting. It's just that we are not aware because there are some substances that we use, particularly things like maybe painkillers, and we are not aware that on its own, it's a problem.
Yes, the conversations that we need to have are quite broad. I mean, at the moment we are looking at over-the-counter drugs, anything that is mind-altering, anything that you are abusing. We are also looking at the recent trend, which is lean, where kids are found buying codeine at the chemist and mixing it with cold drink. And this is why these dialogues are absolutely necessary, because we need to monitor the supply and we need to be able to pick up the trends that are in our communities and address those trends.
And after care, for drug addicts, those that are calling for to be assisted, how important is it that too much effort it gets to be put into that?
It is one of the areas whenever we go to communities always say that, what, we find that we send service users into rehabilitation centers, but they come back into the same community where there's hardly any opportunities for them. There's the aftercare is still lacking. The journeying with the service user lacks in terms of there's not enough resources. And those are the issues that we are addressing today. How best do we support these people? How best do we ensure that we link them to skills development programs, to also continue with their outpatient treatment centers in terms of unlearning behavior. You find that people have been on drugs for 10, 15 years. You cannot just expect that a 6-week program will do the trick. When they come out, it's constant, it's consistent, and it needs everyone. It needs everyone to be empowered and educated on how to address it. We need the families, stakeholders, churches. Everyone has a role to play. We said earlier on, gone are the days where we are with our heads in the sand. This pandemic, people still refer to it. I heard you earlier on, and me too, saying that it's a challenge. But it's no longer a challenge in our country. It's a pandemic, and we need to address it with great urgency. And this is what the CDA is hoping to do. And this is why we're going around the country, hearing from the community. And the community's pleas are almost the same wherever we go. What do we do? Where do we go? We feel failed. We feel not heard. So we are hoping that come to November, when we have our national summit, we are actually able to provide resolutions and respond to the many issues from our communities.
And how will that change, things in the country as a whole in terms of talking about success stories when it comes to drugs and substance abuse recoveries in the country?
We are hoping that the input that we get from today's dialogue, we can look at reviewing policy. That surely would help, and seeing where we can have stricter rules and stricter laws and stricter regulations that we can implement, and that obviously would contribute to a positive outcome.
Another thing, maybe just before I hand over, there's a challenge. I see that South African Police Service are also part of this discussion. And that question get to be raised even a lot, to say that some of the issues of getting drug dealers, police making sure that drug dealers also get to be arrested, and so therefore there won't be so much challenge in the scourge and the uprise or the rising number of people who get to use drugs in the country. How is the work towards dealing or making sure that drug dealers are also, dealt with in the country?
Oh, that actually forms part of the 7 goals of the National Drug Master Plan. Goal 2 speaks to supply reduction, and supply reduction involves the NPA, it involves intelligence, and it involves SAPS. And, for us it is basically to make recommendations to these departments based on the findings. I already know today we're going to get the SAPS are corrupt, you have long waiting lists, court lists, and all of that. That's the type of input that we will be giving, and the recommendations that will come from CDA to say, we need to look at harsher sentences. We need to ensure that our forensics are actually attending to the backlog in terms of testing of substances, so that we don't only have arrests, we actually see that there are prosecutions.
Thank you so much for your time. Let's leave it there for
Thank
now.
you so much.
This is the discussion that will be happening here in Mahikeng in the Northwest Province, but it's a build-up, the Central Drug Authority says that there's going to be a national summit come December later this year to talk about this challenge of drugs and substance abuse that continues to be a challenge to many of the communities, and also not just in the Northwest Province but in the country as a whole.
Absolutely, Refiloe, Seboko. Let's leave it there for now.